And so today I have a slate of experts, clinicians in our hospitals. We will be talking about the work they've been doing to address the inequities in sickle cell disease care, improve the quality of care that patients are receiving. And from our patient community, there are attending today, there'll be a lot of questions, I can guarantee you that. People want to know, are there still gaps that needs to be addressed? And if there are, how do we address these gaps? But before we go into introduction, I want to do a few housekeeping. And one of the housekeeping is that for our attendees, if you have questions as the hospitals are presenting, you can use your Q&A box or your chat box to put your questions. We'll be checking them. And at the end, when all of our presenters have spoken, we will address all of these questions. If you also look on your screen, there on the menu, there is a caption. If you click on that caption, you'll be able to determine in what language you would like to listen to today's presentation. If you're joining us from a part of the world whereby English is not the first language, please feel free to choose your preferred language and listen in that language. About 5 minutes before we conclude today's session, you will see a poll that will come up. We want to get people's feedback on how this session has gone. Are there things that we need to do better or differently, or what works as well? So we would like your feedback. Now, without taking much more time, I would like to start with Dr. Ziad to kind of open today's session for us. Dr. Ziad is a hematologist and transfusion medicine specialist at London Health Science Centre, and is also an assistant professor at Western University. He currently directs the Adult Red Cell Disorders Hematology Clinic at LHSC, where he sees patients with sickle cell disease and Patterson. Dr. Solh is also the head of the Transfusion Medicine Division in the laboratory at the London Health Science Centre. Dr. Ziad, we would like you to start us off to kind of present to us in about 5 minutes or less what the London Health Science Centre has been doing to improve the quality of sickle cell care for our patients in London. Thank you.
Thank you, Lanre, for the introduction. I was not expecting to go first because on the list I was like 5th. I was hoping to say we did what they did, but I guess I'll have to give you more details. But luckily we have a lot of details to share. So in London Health Sciences Centre, we are located in southwestern Ontario, a very quickly growing part of the province. And we are ideally situated between, the tip of the province in Windsor and I would say the immigrant capital of Canada, which is Toronto. So we have a lot of growth in our population here. And so what we've worked on over the past few years, especially since we were able to receive Ministry of Health funding for our program a couple of years ago through the advocacy of SCAGO. I broke it down into about 3 areas. So we've really worked on advocating within the hospital to standardize guidelines and improve care. One of the biggest areas we've worked on is we did a large quality improvement project with our emergency department. Really showed our colleagues in the emergency department what our patients are going through, and we identified how many hours some patients are waiting to get even their initial dose of pain medication, and we presented it to them. We presented it nationally as well at the Canadian Hemoglobinopathy Association, and we were able to enact a lot of change after those data came out. We are still working with the emergency department to get ketorolac, which is an NSAID given by the nurse even before the physician is is able to see the patient, and that's going through our Drugs and Therapeutics Committee to provide that. We had to go through quite a bit to reassure the committee that this is safe in the vast majority of patients, and the safety profile of the drug. But I think it's going to make a big difference. And word of mouth is that this medication is helping our patients. From the patient's mouth, that is. It's helping even more than the opioids that they generally have to wait hours to get. So that's one big thing. We've also really bolstered our human resources. So we now have a full-time nurse practitioner, a full-time nurse case manager, a full-time social worker. We have just hired a full-time transition navigator as well. So we're very proud to have been able to achieve that that improvement in human resources. We have a secretary for the program. Mind you, this is lifespan, so they all work pediatric to adult, which is relatively novel, I would say. I think so. We are being told that not a lot of programs around the country have a full set of team members working from birth up to geriatric ages. And so for that reason, we have had to send our nurse practitioner. We have a very young team. We've sent our nurse practitioner for mentorship in Toronto, and we're sending her to BC as well, just to get as much mentorship and help, because it's quite novel for us, and we can only learn so much from our local setting. The other major area that I would like to highlight is that we have been doing transition of care from pediatric to adult age informally for several years, but now that with hiring transition navigator or facilitator, we're going to be able to do that more formally with data to show our patients that their concerns during transition are hopefully being addressed when they reach their early 20s. And then one of the major areas, I think Dr. Cervi can hopefully speak to that a bit more, is with her presence in Windsor and with her expertise in the growing Windsor region, we've been able to establish a good corridor for our patients who are now receiving excellent care on the adult side in Windsor under Dr. Cervi's supervision and care, and they can come to London for certain tests like ferry scans and other tests that may not be easily accessible in that region. So regional support for other centers, and I think Windsor is such a fast-growing region that hopefully they get more support as time goes by as well. And again, we're also doing that for pediatrics with Dr. Gerard, and we're also working with Windsor to improve their laboratory support of our patients, the blood banking support of our patients as well. So it's been a very rewarding experience to work on all of these fronts.
Thank you so much, Dr. Ziad, and you were just exactly 5 minutes. I love that. Thank you so much for keeping to time. Folks, you've heard what London Health is doing. If you have questions, please put them in the chat or your Q&A, and we will address these questions later. Next, I will go to University Health Network, and I will introduce both Dr. Kevin Cole and Dr. Jennifer Bryan. Dr. Cole, you wanted to say something?
No, I just wanted to say hello to everybody, but I'll let Dr. Bryan go first because we have a very exciting initiative with the emergency department.
Wonderful. I will introduce both of you, and then you will share your slides. Dr. Jennifer Bryan is an emergency physician. She's also the Director of Research in Emergency Medicine at the University Health Network. She's also the Associate Professor at the University of Toronto. She led the publication of the first national recommendations to address racism and colonialism in emergency medicine. And she's also the founding chair of the Canadian Association of Emergency Physicians, Anti-Racism and Anti-Colonialism Committee. Welcome, Dr. Jennifer Bryan. I will also introduce Dr. Kevin Cole, who will be co-presenting with her. Dr. Cole is an adult hematologist and clinician investigator in the red blood cell program at the Toronto General Hospital University Health Network. Its clinical focus is on rare congenital hemolytic anemia, and its research focuses on genetic modifiers and novel therapies in rare congenital hemolytic anemia, the impact of white matter changes on neurocognitive outcomes in sickle cell disease, and non-chelating strategies in the treatment of iron overload. Welcome, Dr. Kevin Coe, and we'll let you start your presentation. Thank you.
Thank you so much, Lanre. And Kevin, do you prefer if I go first? All right,
Yes.
Good stuff. So, I am very excited to be here speaking alongside Dr. Coe on behalf of the University Health Network. I'm an emergency physician, like Lanre has mentioned, and so I'll be speaking from the emergency department perspective. The emergency department at University Health Network includes both Toronto General and Toronto Western hospitals. So the question of whether there is a gap still to be addressed, I think the answer is very clear to us. This was a publication that came out just earlier in October, talking about how our emergency department is meeting the current quality standards. Now, this data is from pre-pandemic, so showing that only 5.2% of visits receiving analgesia minutes of triage as suggested. We've made some improvements, thankfully, since then. We are at last count, we're up around 15%. So heading in the right direction, but still a lot of work to do. I want to talk about some of the ongoing education initiatives that we are hoping are going to get us closer to that 100% level. So first off, lots happening in terms of trying to promote awareness about sickle cell at UHN, including recognition of the National Sickle Cell Awareness Month. So this was a DAP that was shared across the organization, so all of the affiliated hospitals of UHN, as a reminder of what was happening with sickle cell and an encouragement to ask questions. This is Nurse Ruth Apia-Boateng and sickle cell warrior Serena Thompson, who are providing patient and nurse-led education in our departments. After a hiatus, I am pleased to report that these education sessions have restarted, led by Karen Fleming from the Red Blood Cell Disorders Clinic. So our department teams are regularly getting education about sickle cell and about the importance of early analgesia in the emergency department. This year, we also had a very exciting first for the emergency medicine residency training program at the University of Toronto. So this was long overdue. This was a workshop with all of the emergency medicine residents in the Royal College program at the University of Toronto in emergency medicine, with an opportunity for them to explore the current quality standards, to hear firsthand from patients, and to get advice about use of order sets and other practical aspects of sickle cell care in the emergency department. The next steps for us include looking at ways to leverage EPIC, our new electronic medical record, in optimizing care. And we have an emergency department nurse at Toronto General who has become a real champion for sickle cell care in our department, who has taken on a capstone project to look at ongoing quality improvement opportunities. We're also planning to start recognizing some of the champions in care. So who are the members of teams when people get the care that they need in the emergency department? So who of our emergency department nurses and physicians and allied health to receive the pain medication that they need within 30 minutes. So some of the things that have been happening and will be happening in the emergency department. And I'll turn things over now to Kevin.
Thank you, Jennifer. So along with those very exciting initiatives, I'm pleased to report that at the UHN, we have hired 3 new team members. The first, of course, is Karen Fleming. She is a clinical nurse specialist with a focus on programmatic development to improve patient care through education, advocacy, collaboration, as well as delivery. We have also hired a registered nurse, Lillian, and she'll be focusing on direct clinical and virtual patient care, education, and advocacy as well. In addition, we've hired Simon, who is an inpatient nurse practitioner with focus on pain management, reducing hospital admissions, transitions, as well as continuity in care between inpatient and outpatient. We're currently looking for additional team members to join us, which includes a social worker as well as administrative support. From the medical side, though, however, we're still in a deficit. So if there's any residents or fellows out there thinking of getting a job, please come over. We're always in need. Other things include supportive care, apheresis, especially synchronizing apheresis appointments with their clinic appointments, transfusion medicine, finding blood for our patients has always been an issue, right? It's a rare blood donor registry, so anyone who can donate, please. Last but not least, of course, is shared care, coordinated care, transitioning from inpatient to outpatient. That's going to be a big piece that we're going to try to tackle in the near future. This will hopefully reduce readmissions into ER and into inpatients, as well as, of course, shared care with our chronic pain, addiction, and mental health specialists at various hospitals. So with that, I'll draw to a close. Thank you for this opportunity for us to present what we have so far.
Thank you. Thank you so much, Dr. Cole. Folks, again, you've heard what the UHN is doing. I'm sure you have questions for them. Please put your questions in the chat box or the Q&A. We will take all these questions at the end of the, of all presentations. I'd like to move on to McMaster Medical Center, and we have 3 people from there representing. I just want to say, because of time, each hospital has just 5 minutes, so we would need you to pull your presentations together, and I know you can do the magic, and tell us what you've been doing, and to improve quality care in 5 minutes. I'll start by introducing Dr. Patterson, who is an adult hematologist working at McMaster University in Hamilton Health Sciences in the McMaster Hemoglobinopathy Clinic. Dr. Patterson has an interest in health policy and is also currently completing a master's degree in health systems research. Our research interests include promoting health equity and quality of care. Welcome, Dr. Patterson. We also have Ms. Sarah Rachid, who is a social worker in the Hemoglobinopathy Clinic at McMaster University Medical Center. Sarah supports both pediatric and adult patients and has a passion for advocacy, community work, and supporting patients with what they identify their needs to be. We also have Dr. Huma Athale. Dr. Huma Athale is a pediatric hematologist, also working at McMaster Medical Center. She's one of the founding members of the SCAGO Hamilton Wentworth chapter, and she has spent a lot of years supporting patients with sickle cell, thalassemia, and so on and so forth. So welcome the McMaster medical team, and let's hear how they are improving the quality of sickle cell care in their hospital. Welcome.
Wonderful. Thank you so much, Lanre. So we are just going to get started here. So in terms of, I guess we'll begin with some improvements within our clinic on quality care. So what we've noticed between 2021 and now is the expansion of our team has allowed us to have more education going across our organization. So we've been able to do education in women's health, the emergency room, and on the inpatient units. Physician expansion to both pediatric and our adult clinic. We've had an increase in funding, which has allowed for our allied health teams to expand amongst the joint clinic. We've expanded care options in terms of virtual options and getting very creative to certainly meet patients where they're at. And we've been doing a lot of work to educate staff around specifically around the standards throughout the organization and throughout our adult hospital as well.
So some of the improvements that we've done specifically is on the pediatric side with Dr. Athale and Dr. Dua. They have been meeting with patients and families in the ED to try to help coordinate people going home. There's an increased number of patients going for transplant. They currently have one patient post-transplant and another one who is queued up to go, which is very exciting. And we're working on increased capacity to support exchange transfusions on the pediatric side. On the adult side, we have a new order set in our emergency department. We're working on building relationships between our team and the emergency department to help improve care there through education, research coordination, all sorts of exciting relationship building. And we've gotten to welcome Sarah Rachid to our team as a full-time social worker who has been amazing with supporting our patients inpatient or outpatient and really entirely coordinated across our adult and pediatric clinic.
And then this is just a further breakdown just in terms of staffing changes between 2020 and 2021 and now. So we've gone from one adult and one adult hematologist and one trainee to 3 adult hematologists. And you can see the number breakdowns here. So we've definitely expanded and we now have more full-time positions and hoping for that to just continue to increase as we continue to increase and grow as a clinic.
So we put here the quality standards and the various ways that we intend to address them. I'm going to skip over it because we do have a final where we'd like to go forward thing, but this is sort of what we use to anchor our goals and things that we've achieved.
One thing too that we're really recognizing in our clinic is just the expansion of a patient population. So here's just a breakdown, and we're expecting to really, on our ped side, we've had about 1 new patient / like 1 consult a week. And on our adult team, we're expecting to have, we're also seeing 1 new patient a week. So certainly our numbers have grown since our clinic not only started, but also just throughout the past few years from 2021 to now.
Not everything has been sunshine and roses, and we wanted to acknowledge some of the barriers that we have faced and continue to face, such as COVID, launching of our new EMR Epic. We're still working on staff retention and improving our transition planning between our pediatric and adult services. There's space shortages, and getting clinic rooms is a challenge for our organization amongst many others. We're still working to try to address gaps in what support is available in the community, as well as systemic barriers such as immigration and cost and all of those types of things that we're still dealing with. But Sarah's going to take it home with where we'd like to get in future.
Yes, and so we hope our general hopes for not only our clinic, but also for the care that we can provide to patients is continuing to advocate within our organization, within at a ministry level to get more funding for our clinic, continue to provide education throughout the organization at all levels, including frontline and management, and continuing to work with community partners as well to just spread awareness and make ourselves more located in the community to be able to help and meet patients where they're at. So yeah, thank you very much, everybody.
Thank you. That is amazing. Folks, let's continue to put our questions in the Q&A box or in the chat box. And we will take our questions, like I mentioned, at the end of every presentation. Okay, let's go on to the Brampton team. We have Beatrice Kahenya. Beatrice Kahenya is a nurse practitioner at William Osler Health System. She supports the adult sickle cell and thalassemia program, and she works closely with Dr. Andrew Biden. Over the last 12 years, she has worked as a nurse practitioner in various care settings, primarily in acute and complex pain management with cancer and palliative care patients. The sickle cell community is very proud and pleased to have Beatrice here as a part of the William Osler Health System team. Welcome, Beatrice, and let's hear what the William Osler Health System has been doing to improve the quality of sickle cell care in your hospital. Thank you.
Thank you so much, Ms. Lanre. Very excited to be here to represent William Osler Health System in providing this update on what we've been doing for sickle cell care. So as we know, sorry, it's moving faster than I wanted to. So as we know, here in William Osler, we do have both the pediatric and the adult sickle cell program. The pediatric is housed in a different location from the adult. So we have the pediatric clinic at the Pure Memorial Hospital. It's a little bit more established than the adult program. It has been there now for 20 years, working in close collaboration with the Hospital for Sick Children, mostly supporting patients in Brampton and area so that these patients don't have to make these long commutes to Toronto for all their care. So there's that collaboration where every other Tuesday, they do have a clinic and see these patients for comprehensive health assessments. I think they do champion all the QI work to do with sickle cell pediatric care within the hospital or the sites. The adult program is where I learned as a nurse practitioner. This program is a little bit younger compared to the pediatric program. We now celebrate our 6-year anniversary. Established back in 2017 by my colleague physician, Dr. Biding, who was a lone ranger at the time, offering just a half-day clinic once a week. Recently, last year, we were able to receive new funding to have more staff within the team. That's me as a full-time nurse practitioner for the adult program. Our social worker, her prep was only 1 day a week. Now we are able to have her available to our patients for Thursdays and Fridays. And we do have more nursing support during clinic, during the Friday clinic to help with transfusions, blood collection, and such nursing type of care. So our Friday clinic has grown from just a half-day clinic to now a full-day clinic. I remember Dr. Solh mentioning how challenging it is within the hospitals to find the space to do this. So this has required an extra room for care and more hours within this very busy Friday clinic at our outpatient medical clinic. So we are happy to have that. And we also do have increased capacity for transfusions. And through the nursing support that we have been able to achieve, we are able to have most of these patients not, just also to mention, we're in very close collaboration with our colleagues at Toronto General Hospitals. Some of our patients are at a shared care model. So what we're doing with the transfusion program is to limit how many times they have to commute over to Toronto for these transfusions, and we are building capacity to be able to repatriate most of those patients living in Brampton to receive care close to home within our clinic. The other important initiative we have had just within the last year is to be able to afford inpatient clinical support for our sickle cell patients once they get admitted. That's mostly through me within Brampton Civic hospitals. Once these patients are admitted, I'm able to go see them in eMERGE, become that extra layer of advocacy, of clinical support, and I'm able to follow them through their admission in the wards and support seamless, smoother transitions from hospital to home. We also do have a dedicated one phone number where these patients can call to the sickle cell phone line when they are at home and needing support. One of the challenges we have with our patients is access to primary care providers. Most of them actually, we did review, over 60% of our patients don't have somebody to call to if they have uncomplicated or mild concerns at home. So establishing the phone line has been of great help for the patients when they need some support on minor and complicated pains that can be supported within their home environment. So they call to this phone number. It's attended by myself and Harpreet, the social worker. So if they do call for pains, I'm able to, most of the times, not all the times, troubleshoot, set prescriptions over to their local pharmacy, and that way we can avert some of the unnecessary ER transfers. I believe that has been one of the tremendous additions to our program as reported by the patients. The other initiative we have had is to scale up the education sessions amongst our staff within Osler. Just this summer, we were able to do 12 sessions to about 18 nurses within Emerge and in our outpatient medical clinic. Mostly just creating an awareness on what sickle cell is and what are the barriers that these patients have and how can we better support them. Also getting to hear from especially within the ER, what the challenges are so that we can support effective and efficient work processes. And some of that has led to the mini QI project that we have undertaken. We do have order sets for ER and also for the inpatients once these patients are admitted, just to review, to make a standardized process on what should not be missed when these patients are seen. Making sure the incentive spirometries are added on, hydration, things like making sure we don't do ice if they have pain and apply warm blankets, all those nuances that can really be of benefit when we take care of these patients. We are also working on looking at some of the medical directives that could augment the care. Unfortunately, we can't do for controlled substances, but we do have one in place for pediatrics that has some NSAIDs, some Tylenol that can be provided right away, or some of the labs that need to get going. And we're working on developing one for the adult patients. So what else has been a recent priority for our program? So we're doing all this great work. I'm
sorry, Beatrice, I didn't want to cut you, but you have about 2 minutes more. So
okay, that's okay.
Thank you.
All right, so we are working on creating awareness, social marketing to all the stakeholders. So this great work that we're doing, we believe it should be everybody's business. We are doing great work. Our patients and and their families are also doing great work. But then we also need to pull in our healthcare planners, our funders, through creative strategies to get them more engaged and support us in this work. So one of the things we did in September, in line with the Sickle Cell Awareness Month, was to put out a certain newscast. Probably you have seen this. I'm putting in a link here. We're not going to view it, but I just put it here in case you might go to YouTube and Google and check up Sickle Cell Clinics Transforming Care, where you'll be able to see the video on what we did. It's a good summary of our work. So this newscast was able to catch some attention with some of our, actually Ontario Health, who got curious. And in the last few weeks, we've been able to meet with some of their key leaders, looking at what the gaps are. And for us, being able to communicate that. And I think actually this week we got some great news. It's still early. We don't know that they are scaling up sickle cell, how sickle cell is being delivered, not only within our hospital, but across the province. And of course, we're also engaging with the provincial Black Health agenda to enhance the care for these patients. This week, actually, we met with a patient experience patient. She's the CEO. She's the main person with the patient relations office. And we're looking at how we can even be more proactive in providing some input into the big project that's underway on the Pure Black Health and Social Services Hub. So then any gaps that exist can be addressed and through this process. So I think that's it for now. One of the questions that Lanre might be asking might be on what else we're doing to reduce the complaints or to prevent this from happening within these hospitals, which we'll be able to address in the follow-up session. So that's it for now. Thank you, everyone.
Thank you so much, Beatrice. Thank you for all the great work you guys are doing in Brampton area, in Peel region. Last but not the least, I have Dr. Andrea Cervi, who is an hematologist at the Windsor Regional Hospital in Ontario, where she currently serves as a thrombosis department head. Her practice is mixed, but predominantly focuses on non-malignant hematology with an emphasis on hemoglobinopathies and thrombus. Without much ado, I will give it to Dr. Andrea Cervi. Welcome, and let's look at how Windsor area, the Windsor Regional Hospital, is improving the quality of sickle cell care. Thank you.
Thank you so much, Lanre, and to SCAGO for the opportunity to update everyone as to where Windsor stands in terms of provision of care to our patients with sickle cell disease. So Windsor, just a little bit about us here, Windsor Regional Hospital. So we are a community-based hospital in southwestern Ontario, a little bit further down the 401 than Dr. Solh and the hemoglobinopathy clinic in London. We serve a catchment area of about 422,600 patients with 642 total funded beds. The majority of those beds are occupied by medicine-based services. We do have 82 beds for emergency room, 57 for critical care, and about 20 for pediatric inpatient care. A bit of a breakdown of our patient population here locally. So speaking for the adult clinic, we do have roughly 21 patients with sickle cell disease and 7 patients with the transfusion-dependent thalassemias, taking the number to about 28. However, we do acknowledge that this is likely an underestimate of patients within the region, given that a proportion may seek care across the border. We do border Detroit, Michigan, and so some of our patients are probably seeking care there. And as Dr. Solh mentioned, we do have a wonderful shared care model with London Health Sciences Center for several patients as well. My pediatric counterpart unfortunately couldn't make it to the meeting, but Dr. Gerard does pediatric hematology, and he estimates a total of about 25 patients with sickle cell disease in his pediatric practice. So in terms of the gaps that we've sought to fill since joining about a year and a half ago, almost 2 years at this point, we have been successful in establishing order sets for patients with sickle cell disease presenting to the emergency room, and then a separate order set for those warranting inpatient admission, with particular goals to really augment and support the rapid administration of analgesia for patients when they're presenting with vaso-occlusive pain crisis, and also to guide assistance with recognition and managing some acute complications that can arise during inpatient admissions and minimizing morbidity and mortality. With the implementation of these order sets, we have delivered a number of education sessions, both to the divisions of emergency medicine and internal medicine, along with the Department of Anesthesiology. And we've also done some sessions for some of the clinical practice managers locally in nursing and pharmacy. As Dr. Solh mentioned, we do have a shared care approach with London Health Sciences Center, and I do think that's helped patients within our region because it is about a 2-hour drive from Windsor to London, so it's cut back on the frequency of long travel, and we can, help with testing and certainly referral to other specialists within our area locally. So we value that relationship very much. And through Lanre and SCAGO's initiative and assistance, we have submitted a proposal to the Ministry of Health for a funded and dedicated hemoglobinopathy clinic, both between the adult hemoglobinopathy and pediatric hemoglobinopathy populations, where we've requested access to dedicated nurse practitioner, clerk, and social work supports. And we also have a pathway for referral to cellular therapy. Dr. Dr. Gerard in our pediatric hemoglobinopathy clinic, he does have 2 patients who are being evaluated by Toronto for allogeneic stem cell transplantation. So we do have a dedicated referral path there. So I think, unfortunately, there are a number of gaps that still exist, and we do hope to implement more of a quality improvement initiative for the rapid provision of care within our emergency rooms. I think that's still where there is a lot of work to be done, because patients, unfortunately, are still having to wait a significant amount of time before they're able to be assessed and triaged appropriately. But I do hope that with our order sets and more education initiatives that we can kind of help to address that further. And we're very, very hopeful for some formal funding for allied health support for a dedicated clinic here in Windsor too. And so hopefully our gap is getting a little bit smaller, but still more work to be done. So thank you again so much for the opportunity to present.
Thank you so much, Dr. Cervi. I'm looking at the Q&A and the first question, actually. We go to you, Dr. Cervi, because you're close to the US border. One person is asking why does patients seek care across the US border? Can you say more?
Yeah, so that's a great question. So there has not been previously any formal hemoglobinopathy directed care in Windsor. So the hematologists that are currently here in terms of adult hematology practice within the cancer program. So their practices are entirely malignant hematology based. So my practice is entirely based within our cancer program, but I'm mixed, and I'm about 60% non-malignant hematology, 40% malignant. So part of a reason I think that patients do seek care across the border, especially if they happen to work there, because it's about a 10 to 15 minute commute to hop over to Detroit, Michigan. So a proportion of people do actually work there and may have some health coverage there. I think for, sort of lack of knowledge that there is now an opportunity to get care in Windsor, people are, seeking quicker services in the States.
Thank you. Another question is for Dr. Kahenya. If you can put the link in your presentation in the chat box for people to be able to go to that YouTube link and watch the video. Thank you. Now, I wanted to thank the attendees of today's session. I'm sure we have a lot of clinicians and patients and industry partners who have interest in this topic on the call today, both on FeedLoop and through Zoom. And I want to thank my good friend, Dr. Athale, all the way from Kuwait. I see that you are part of today's session. Thank you for joining us. And for our hospital panelists, you have all presented eloquently on the great work that you're doing to improve the quality of sickle cell care in your hospital. Yet, we continue to witness a continued rise in complaints on the quality of care that patients are receiving in Ontario hospitals. It's really alarming. We have a WhatsApp group, and there's no hospital. People have gone to different hospitals, and they are putting on the WhatsApp forum that they're just not happy with the quality of care. And we know you're doing a lot of great work, but there is still gaps. There are a lot of gaps. Now, how does your hospital intend to change this narrative? And I'm going to give everyone about 1 minute opportunity to just tell us in a few words what else you can do to change the patient's narrative from, I didn't get a good care, I was not treated well, or I was left for hours without getting pain medication, or the triage took for a long time. Whatever it is, what else can your hospital do to change this narrative? And I'm going to start with Dr. Jenny from Bryan and UHA. Thank you.
Thank you so much, Lanre. And thank you for allowing me to share screen again. These were wasn't able to show earlier, but I want to emphasize how important it is that we hear from patients. That is an incredibly difficult thing to do, to give feedback to your hospitals, and I know that that people feel in a very vulnerable position in doing that. But that is really the best way to make change within the hospitals. I just wanted to provide the information for our patient relations team. We have a representative, Caitlin, from the patient relations team, who's part of our emergency department sickle cell working group, recognizing that, making that connection from patients to the provider. And so I think that the fact that people are reporting that there are gaps in their care, I don't want there to be there, but I am very glad that people are reporting, speaking up, because really that's the only way to make a difference. So just wanted to share that information for anyone who is cared for at UHN. If you have had any concerns, please do reach out, because we really want to hear from you so that we can continue to improve.
Thank you, Dr. Bryan. Dr. Sarah Patterson and Sarah Rachid, how could McMaster further improve on the great work that you're doing, so that patient narratives could be more positive? Thank you.
I think, Ms. Lanre, I can take that question if that's okay.
Yes, please. Yes, Dr. Athale.
Yeah, and I think I do agree with Dr. Bryan that it is very important to hear from patients, because everybody's experiences are different, and we keep learning, because we think we have done some change, but then there is something new that comes up, and that just allows us to improve our approach and our care model. So I think hearing from people is very good. We do have some unseen challenges, because now we are very thankful to SCAGO and the ministry's support. However, as we have shown in our number, and I'm sure it's across the province, I think we are seeing exponential growth in our patient population. And soon we will have to kind of look at some innovative answers to how best can we do that. Do we have a clinic? Currently, we have only half a day clinic. Do we have a clinic time which is more? Can we provide some sickle cell only kind of daytime open clinics across the province, that people can go there? And there is, like in the regional area, whether we can have some places where they can go for a short stay, getting treatment, rather than waiting for a general emergency room and waiting for evaluation, because as you know that emergency rooms are also overburdened. So I think we certainly need to continue the dialogue within our own institutions, but across the institutions and across the province. And SCAGO is doing a great job in bringing us all together. So I hope that these things would continue us to improve on an ongoing basis. Thank you.
Thank you. Dr. Ziad, what else can we get done in London to change people's narrative?
That's a question. I think, just continuous engagement with our heads of divisions and updates about the current quality improvement metrics that we've put in place. So we, things like in the emergency department, we want to make sure our patients access to pain medications and, waiting in the emergency room times get diminished. So, we just will continue to follow those metrics and feed them back.
Thank you. Sorry. We have the poll open. Please, folks, tell us how we have performed on this session. if there are any feedbacks, anything that we need to change or improve, what works well, what do you like, what don't you like? This would like to hear from you. We will continue with our question, Q&A. I have another question in this Q&A, but I'll let Beatrice and Dr. Cervi also tell us how they are going to improve patient narratives around the quality of care. So I'll go with Beatrice first, and then we'll finish that question with Dr. Cervi. Beatrice, thank you.
Thank you, Ms. Lanre. I just want to highlight this one slide here on the data that I actually went to the data and performance office just to find out what's happening with our hospital. So this slide here is for our Brampton Civic Hospital. As you're able to see, our Brampton Civic site is really maybe the busiest emerge that we have across in the country. So ranking number 1 amongst 177 hospitals, receiving about 325 visits in a day. Our said Clyde Hospital, Etobicoke, still amongst the top 10, servicing 244 visits a day. So for me, this what simply tells me it's true, patients eventually might need to come to the hospital for more complicated pain scenario or whichever other complications they may have out of sickle cell. But really, Emerge is not the place for most of these patients. If there's anything we might want to avert from coming to Emerge, we want to prevent that because the demand really outpaces the capacity for these units. So one of the things we have done, like I did mention in my presentation, is to strengthen the capacity for the sickle cell phone line. For those things that don't need to come to Emerge, we want to be able to troubleshoot them right from home and prevent the patients from coming. And strengthening comprehensive care for outpatients, encouraging and following through treatments, hydroxyurea, encouraging or supporting the transfusion programs for those patients who may most benefit from that. I also did actually want to find out some more data from our Chief Patient Relations Officer about how many complaints are coming through. And she did give me some data. In the year, for the fiscal year 2021-2022, their office only had 5 complaints recorded. And those were mostly around communication, transitions of care. And I don't know, they seemed few, but they could be more. So one of the things I will encourage any patients who are participating here today, or that we should be encouraging our patients to voice these complaints through that forum, so that we get to know what these are, because one commitment we have is to, of course, improve the care for them, but we don't know until we get to know about it.
Thank you, Beatrice. Another question for you while I still have you here. One of our attendees is asking, how many calls does William Osler Health System receive on their sickle cell phone line? And is the phone line open from 8 a.m. to 4 p.m. or what are your hours for the phone line? Thank you.
Good question. So to be honest with you, I'm a lone ranger in receiving these calls, mostly to do with clinical concerns. On average, I will tell you I do receive about 10 calls in a day. Those are coming from the patients, but using the same format, I'm also able to call them once I get some updates for patients who are admitted maybe in other hospitals, and I just want to also follow up to make sure they're settling well and they're okay at home. So on average, so far, about 10 calls, and I do work Monday to Friday from 8:30 to 4:30. Some of those times, of course, I'm at the outpatient clinic or attending to the inpatients, but the patients can call during those hours.
Thank you so much, Beatrice. Dr. Cervi, I know you're still waiting on the Ministry of Health funding, but in the meantime, what can you do to ensure that our patients in the Windsor area do not cross over to the US for treatment? How can you also ensure that when they come to Windsor, hospital, they get quality care? What can the team do in the meantime before you get this funding that you need for your clinic? Thank you.
Thanks, Lanre, for the question. I think for us in Windsor, there's two huge areas that we need to sort of further our focus on, and one is emergency room directed care. So I will say that having, one of our education sessions when the order sets rolled out with the Department of Emergency Medicine, it was fairly enlightening because obviously, as Dr. Athale had pointed out, the emergency room is under considerable constraints. But it was not necessarily universally recognized that there needs to be very prompt recognition of a pain crisis in order to help to break the cycle quicker. And so kind of briefly reviewing some of the recent Ontario quality initiatives was actually very helpful there. So we do actually want to look at this in a more systematic and objective way and actually look at how many patients are presenting within our region to the emergency room, what are the wait times, and what is that time from first presentation to provision of analgesia. The second point, as you mentioned, to sort of prevent people from necessarily seeking out care across the border, because it is problematic when a patient's care is entirely in another country and then they present to the emergency room and we don't have access to the care that's been provided, is raising a little bit more awareness that now there is opportunity to provide care to our patients locally. How that's been done so far has mainly been, again, through the education sessions and as I've been here getting to know more people, and just fortunately we have received some more referrals from our family medicine specialists and Dr. Solh as well to kind of help with that shared care model between Windsor and London. So I think those are two big areas of focus while awaiting and crossing our fingers and toes that our Ministry of Health proposal is reviewed favorably as well.
Thank you very much, Dr. Cervi. And this is all the time we have today for this session. I want to thank you, our esteemed panelists, for your time today. And I want to thank you, our attendees, for giving us that opportunity to present to you what the hospitals are doing to improve the quality of sickle cell care. I think we are a team. We are all part of a puzzle. And so as Dr. Bryan and Beatrice and everyone on this panel has spoken and said that it's very important to, let patient relations know what is not going well. And many times when even SCAGO, we have spoken at hospitals and complained, and they will say to us, there's no statistics to say that sickle cell patients are not getting the right care. They are not complaining. We understand why they're not reporting. Sometimes there could be backlash to that. And some of them have witnessed that backlash. But let's still complain. Let's do that. It's important because without facts, without the data, it will be very difficult for them to know what needs to be improved on which areas. Is it communication? Is it like what area needs to be improved? So I want to thank everyone. And I want to let you know that our next session starts in 3 minutes. Is the equity plenary on mental health, intersectionality, and sickle cell disease. Please join us using your Zoom link on that session. Thank you again for being here. Thank you. Thank you, everyone.